Welcome to our Mentor Spotlight, a live conversation to explore the role of mentorship in developing the professional identity of physicians. I'm your host, Marielle Bugayong, and I'm really excited because tonight we have a very special guest. Dr. Paul O'Rourke is an assistant professor at the Johns Hopkins University School of Medicine. He also serves as an associate program director for the internal medicine residency program at Johns Hopkins Bayview Medical Center, and he co-directs the Johns Hopkins Medical Education Pathway, a longitudinal medical education training program. Paul spends much of his time teaching and advising internal medicine residents and medical students, and at the national level, he's active in the Society of General Internal Medicine and the Association of Program Directors in Internal Medicine. So, as you can tell, he wears many hats as a clinician, a teacher, an advisor, and a researcher, and we're so grateful to have him here. Welcome, Paul.
Thank you so much, Mari, as a very, very kind introduction. And it's my absolute pleasure to be joining you this evening. I'm very excited.
Yeah, thank you as well. So to start it off, tell us a bit more about yourself. What inspired you to pursue a career in medicine?
Sure. No, it's a great question. And as I reflect back kind of on my life, I think compared to a lot of my peers, I did not know from a young age that medicine was my calling. I think if you would ask my parents if they could even guess when I was in high school, it may be near the bottom of their list in terms of future careers for me. And in large part, it was because I always had a variety of different interests. I remember as a young boy loving mysteries. And with my grandfather, Opa, we would come up with different mystery stories. We'd read Sherlock Holmes and Watson and come up with our own Sherlock Holmes and Watson cases and write them down. And I love the pursuit of solving mysteries and thinking up a really compelling case. And for a long time, I thought about writing for that reason and writing mysteries. And as I got a little older, I started becoming really interested in science. For a while, I thought I was going to be an astronomer. I loved space and learning about the planets and thinking about what else may be out there beyond our current understanding. And I loved dinosaurs and thought I may want to be a paleontologist. And as I finally got into high school, I started developing another love, which was history. And it kind of surprised me as well. But I think the thing that really appealed to me with history and what still appeals to me about history is not an interest per se in the specific dates, like of when things happened, but it's the stories. I loved learning the stories about people, who they were in history, why they did the things they did, how they impacted their communities and world. And I think as I went into my undergraduate years at the University of Florida, undifferentiated, not sure exactly what I wanted to do, I became more and more fascinated with medicine. And even though those interests I had before may not seem necessarily related, I think medicine did combine my love of mysteries and science with a human element, the human element that I really liked with history too, and stories. And I was inspired by the idea of a profession, a calling that would allow me to apply the knowledge and skills I learn to help improve my patients' well-being. And so I do feel very fortunate and blessed to be able to do this calling, to be able to help patients and keep up with new updates in science, to be able to provide the best and most compassionate care I can.
Yeah, and that's really incredible. I really love, hearing how you've been able to tie all these interests and sort of the chronology of it, how you developed your passion for medicine as it stands today. So kind of segueing into the next question then, in your opinion, what characteristics does a good doctor have?
That's a great question. It's a great question, Mari. It's something I've certainly reflected on a lot over the years, particularly in my role as in a residency program, because it's often asked like among students and residents too. And there certainly is not an easy answer, but there are certain attributes that I think are incredibly important. And one in particular is a teaser that I think is core to the foundation. I think the best way of describing it, though, is really to borrow a metaphor from a current mentor of mine. And that mentor is Dr. David Hellman, who is the former chair of medicine at Johns Hopkins Bayview and is a professor of medicine at Hopkins. And he has an art with metaphors. And I think he beautifully expressed that the way in which he views medicine is that the genetic makeup of medicine is that it's a triple-stranded DNA. One strand is for science, having a science backbone. The other is for caring. And the third strand is for justice. And I think that those three attributes, I think, are extremely important. Somebody that does appreciate science and wants to keep up with the advancements to provide the best care possible for their patients. One that embraces the importance of social justice, of wanting to promote equitable care for all patients, to reduce the disparities that we're currently seeing in society. And the caring aspect is so key. And that's why getting at the thing that I think is most important, it is that caring strand. I think that's really the primordial strand, the main backbone of that triple stranded DNA that Dr. Hellman talks about, because without the caring, you wouldn't have that connection with patients, that drive to do everything that you can to help them out. I think that's truly the heart of an excellent doctor. As you had mentioned in my intro, one thing that I really love is medical education. And I mentioned I liked history, so I'll give you a quote from somebody in the past. There was a really famous medical educator in the early 20th century, Dr. Francis Peabody. And he had a very famous quote that he had given where he said, "The secret of the care of patients is in caring for the patient." And I think that really gets to the heart of that caring truly is at the heart of being a fantastic physician and having to have that empathy.
Yeah. Thank you so much. That's a really great response. And honestly, the first time that I also heard of this, triple stranded DNA, like that's I would say, a really great visual representation of what it means to be a good doctor. So thank you for that.
You're welcome. Well,
Um,
I honestly have to say that's the power of talking about mentorship. That's
yeah,
purely from one of my mentors. So Dr.
yeah,
Hellman is who artfully kind of thought of that visual representation.
yeah. And actually, so this is a great segue. So on the role of mentorship now, what mentors have you had throughout your professional journey? So it sounds like you've mentioned one of them. Feel free to expound on that or on others as well.
Sure. I think I've felt very fortunate in my life to have had incredible mentors and role models. I wouldn't be where I am today if it wasn't for them. I would be remiss to not say from the beginning, I've been very blessed with loving and caring parents who supported me through all of those various interests of mysteries, dinosaurs, space, and history. And throughout the ups and downs, were there for me and continue to be there for me throughout the way. And so they've played a tremendous part in who I am today. I've had amazing mentors through all of my schooling. But I think to highlight just people that have recently and continue to make such a big part of my life, there are a few names in particular I feel like I'd like to give as an examples, because I think that there are certain attributes from them that really demonstrate the power and things I've really appreciated of them as mentors. And I did allude to Dr. Hellman, who's an incredible mentor, to talk about two other mentors that I have currently in my life and have been mentors of mine since being a fellow here at Hopkins, would be Dr. Scott Wright and Dr. Erica Johnson. Dr. Wright is the division director of general internal medicine at Johns Hopkins Bayview and is an internationally renowned medical educator. He is truly a wonderful physician, a very compassionate soul. He helped create the Closler program, which provides a lot of wonderful content online of really getting at humanism in medicine and forming connection. And I think one thing that I continue to really appreciate from his mentorship strategy of me was the fact that even when there were things that I was very passionate about that I know, and he was honest with me, that weren't his cup of tea, he always would embrace them. And he still does. He would try to learn everything he can about those areas and help support me in my pursuit. And I thought I've always greatly appreciated that aspect of him, that even if it's not something that may be his specific niche, he always has been there to support me on the things that I care about deeply and help me pursue and push along my interests. And I think that's such a wonderful attribute of a mentor. And he's been an incredible role model to me with that. For Dr. Erica Johnson, she is the program director of the Johns Hopkins Bayview Internal Medicine Residency and an assistant professor in the Division of Infectious Diseases at Johns Hopkins. And she is really my boss too, as being the program director of the residency program, where I'm an associate. But much more important than that is as a mentor, a colleague, and a very close friend. And I think one thing that I really appreciated from her mentorship is specifically her role modeling of how to be a tremendous leader. She is really an incredible leader of our residency program. And it was best kind of demonstrated even during these struggling times of the COVID-19 pandemic. Her thoughtful approach of ensuring that things are fair and equitable for all members of the team is really inspirational, and it is something that I'm continuing to learn from and trying to learn skills. So she's provided me tremendous guidance. So they're just a couple examples of really amazing mentors who have helped shape me.
Yeah, thank you for that. And, I'm really great that you're able to make these shout outs and sort of, recognize them for the great work they've done in shaping who you are today. And of course, I'm sure you're also being a great mentor to, the residents and the medical students who you look after. So it's interesting. So you mentioned that there's a key role of mentorship, and this is a bit of segue, but there's a key role in mentorship, especially in these COVID times. And so I guess tying that in with the next question, what do you think are the characteristics of an ideal mentor, and what characteristics might even be more important given the new normal that we're facing right now?
That's a great question too. I think that characteristics of an ideal mentor, I think that it's particularly during these times of the COVID-19 pandemic and when you're going through challenges that are going on in the world, I think it's incredibly important for an excellent mentor to be present with their mentees, even though no doubt their schedules will be incredibly busy, that they always find a way to make time to be there for their mentees, to respond to that email, to make that late night call, checking in on them, making sure that they're continuing to pursue their goals and passions, and that you're connecting them with the resources they need. Um, I think that's incredibly important. I think another aspect too is that they have to have a genuine interest in their mentees, and not only an interest in their professional development, but also in their overall well-being. So caring about how they're balancing their professional and personal lives, because you want them to be the best person that they can be. And going along with kind of the example that I gave with Dr. Wright, I think a truly incredible mentor isn't interested necessarily in making a carbon copy of themselves. They're willing to be able to look beyond maybe their own personal interests, and what they're really interested in is helping your mentee be the best version of him or herself, to be able to pursue their dreams and to be able to make the career path that they really want to achieve. And so I think that those are all aspects of ideal mentors.
Yeah, thank you for that. And I know that was a bit of a curveball, but I think that's a really great response. Being present, being there in the moment, and as you said, not necessarily making a carbon copy, but helping even the mentee figure out for themselves what's important, how do they prioritize it, that sort of thing. So now I'm kind of curious, you've talked about your mentors. I'm curious, how would you describe your own role, being a mentor to residents, to medical students? And maybe if you're willing, providing an example of a mentoring relationship you've had.
Of course. Yes. I think the way I aspire to be a mentor is to really be a partner in the journey of my mentee, of partnering with them, and helping them find their path. Um, Oftentimes, my role is really more reflective rather than prescriptive. It's more doing a lot of active listening to my mentee, what their interests are, what their passions are, what they're thinking that they may want to pursue, and helping them explore that rather than me directly giving advice. And then based on kind of their dreams and interests, connecting them with the resources and people that'll help them achieve their objectives. Um, I think one thing that I try to be as much as possible is being present with them too, making a point to regularly follow up, to check in on progress of certain goals that they had and how I can be supportive, um, and to be able to get them connected. And even though I know it's something a little different than being a mentor, I think another thing that's important that I try to aspire to be is a good sponsor as well. And sponsorship is truly about trying to help your mentee or the people that you're hoping to sponsor reach the kinds of positions and opportunities that they may aspire to be. So I always like to keep that in the back of my mind too, as I'm working with my mentees, of how can I maybe get them connected with opportunities to have a role in their professional society or to do work in an area of the hospital or in the institution that I know that they'd be really passionate about.
Yeah, that's really great. And I'm glad you're able to, touch on those different facets of, being an active listener, being a sponsor for them. I'm sort of curious, and this is a bit of segue again, but how have you seen your mentees grow as you've, talked with them, discussed their interests, figured out, where their journey is taking them?
That's a great question. I think that the thing that I've kind of grown to appreciate, and I hope this is the case, and I've certainly felt it in my early career, the personal fulfillment that I've gotten being a mentor to my mentees. But so I'm hoping my mentors feel the same way. But I think that they have. It's been really wonderful to see the relationship develop, and I think that's the beauty of like quality mentorship. That it's truly rewarding, just as rewarding for the mentor as the mentee. And I feel like I can't speak per se for my mentors. Hopefully they feel this way, but I think the relationships that I've developed with them, I can see how much they've appreciated it too. And being able to help me along my journey has kind of made their own journeys that much more fulfilling and have gotten them involved in areas and projects they may not have been interested in before. And that's true for myself. I mean, a lot of my mentees, I can give an example of one fantastic physician, Dr. Carla Kendrick, who she's currently a general internal medicine fellow at Harvard and was a recent graduate of the Johns Hopkins Bayview Medicine residency program, who was very passionate about health disparities, and which is an area that I do work in, and that it means a lot to me too. But she specifically was interested some in kind of doing some work with pipeline programs, kind of STEM programs, and how to promote diversity within the medical workforce. And even though I've done a lot in medical education, I hadn't really done very much in pre-medical school kind of education, let alone high school people interested in medicine. And that was something kind of based on her interests. It was really fun to jump into that venture with her. And we ended up doing a lot of work studying a program here in Baltimore City called the Merit Program, which is a fantastic organization that helps underrepresented minority high school students who have an interest in the health professions get the education and mentorship they need to thrive. And these are incredible, incredible scholars. And we ended up doing a study looking at some of the attributes of amazing clinical preceptors, like who makes the best clinical preceptors, and had that study published in the Journal of the National Medical Association. And that process, I can genuinely say, I gained so much from that, probably more than Carla did. It was such an honor to be able to have that relationship. And I think that's the beauty of it. Is such a fulfilling aspect to have that mentor relationship, as it is to be a mentee. For Dr. Wright and Dr. Johnson, I learned so much from them. So it's very fulfilling. It's just part of the professional journey.
Yeah, I love that. I think, and that's a great story that you've just told about, working with your mentee and discovering more about health disparities, looking into the merit program, which interestingly enough, small world, I am familiar with that too. I was a volunteer for a bit
Wonderful.
there.
Very
Um,
cool.
but yeah, it's really great to see, just not just how your mentees are growing, but how you as a person are also developing through it. So it's sort of, the good goes around in this sense.
Mhm.
Um, but yeah, I guess, moving on to the next question, how, if at all, do you think the role of mentors has changed over the years? Given the changing landscape of medicine, has mentorship and its purpose sort of stayed the same, or are there other facets that have been added or subtracted from it?
I can't say this for certain, but from stories that I've even heard from my mentors, I think one evolution that's occurred in mentorship, at least within the medical field too, is this thought process that it should be more of a reflective exercise of the mentor rather than prescriptive. I remember hearing a lot of stories from people in the past that when they would meet with mentors, almost the expectation was that the mentor would say, I want you to do this, what I'm doing in my lab, like that's my passion. And I kind of do want to make you a carbon copy of me. And it might've been coming from a good place, but wasn't as mentee centered or learner centered. And I think that that has been a big evolution in terms of the mentorship relationship, that now people more and more appreciate that being an excellent mentor is not about making that carbon copy. It's about helping your mentee become the individual and the physician that they aspire to be, helping them explore their own passions and goals and dreams so they can fill that role that they would have aspired to be, that they really have a great love for. And that may not be the specific specialty that you have. I say to my residents all the time too, I personally am a general internist and I'm a primary care doc. So I love primary care, but I tell them all the time, I will be just as happy, if not more happy. I want to see them in a career that they feel incredibly passionate about. If that's a cardiac electrophysiologist, then so be it. If they go in every day and love it, that's what I want for them. The same passion that I feel with my work, that I really enjoy primary care. And I think that's been a big change over time too, of people recognizing that mentorship is really more about guidance and reflecting with your mentee rather than providing them prescriptive advice.
Thank you for that. And it's really great. So I'm hearing these themes of, empowerment and partnering. And this might be a conversation for another day, but it reminds me of, patient-centered care and, bringing it back to medical care, what we encourage or how we encourage that relationship to look like between doctors and patients, of being compassionate, being understanding, doing active listening. So it's interesting how, again, all of this ties back together. Thank you so much for your response. I guess so. Now moving on to another question, and this actually might be a bit more reflective for you as well. Looking back, what is something you know now that you wish you knew before? Or, in other words, what advice would you give your younger self who is just beginning medical training?
Yeah, that's a really good question too, Mari. That's a really good question. I think as I would reflect on that, I would think of a piece of advice that, I'll be honest, I continually just still have to give myself. It's not something by any means that I've mastered. It's a work in progress, but I think that would be the importance of having a growth mindset. And the idea of having a growth mindset rather than like a fixed mindset is an appreciation that we all make mistakes. We all make missteps. And rather than seeing them as personal failures and being hard on ourselves, which I'll be the first to admit I still do and I still struggle with, appreciating them more as silver linings, as opportunities for growth. Because truly, we wouldn't get better if it wasn't for mistakes. And even though in those moments where maybe we don't get the result that we want, we lose the game, we miss the kick, if you didn't have those moments, you wouldn't get better. You wouldn't get stronger. And as I reflect back on my own journey, I certainly have had challenges, as everyone has had kind of their own challenges. And I know if you would have asked me during those moments when I was maybe struggling with something, is there any way that I could just get out of this? I probably would say yes. Honestly, when I look back now at those moments of challenge, I wouldn't change anything, because those moments made me who I am today. They made me the person and the physician that I am today, and hopefully helped cultivate the empathy that allows me to relate to my patients who are going through those struggles, those obstacles, those losses. Never that I can fully put myself in their shoes, because everyone's unique experience is different, but at least provides me the ability to have perspective and to relate. And so I think that would be the main advice of embracing a growth mindset, appreciating the fact that no one is perfect, nor should we want to be. Because in fact, even though it's hard, those failures and mistakes, they make us stronger. They make us better people and better physicians.
That's great. I definitely agree with that growth mindset as well. Of course, like I've encountered personal challenges as well. And it is interesting looking back and seeing that, maybe there was some purpose in it, in being able to, figure this out, being at this low point, but realizing that you can still rise up from it. You can still improve yourself from it. I'm curious, and if you're willing, of course, would you be willing to share what one of those moments was for you?
Yeah.
Like what was going on and what did you learn for it, or what did you learn from it?
Yeah, I think that for me personally too, certainly as I was going through schooling, I dealt with a lot of significant anxiety. And that was a very tough challenge, and that I was fortunate to have the support of family that helped me through that. And I definitely, as a result, made things challenging in school as well as I was trying to learn. and made things difficult. There were definitely moments, lots of moments where I think it made me, question whether I'm on the right track, whether I truly belong. But when I reflect back now, even though those things obviously still hurt, those obstacles that we deal with, those challenges that we deal with, I did get amazing help from people. And I truly can say I look back now and I wouldn't change it. I wouldn't change it because I like where I'm at. And I think the person that I am today is a result of those challenges. And look back and think, no doubt they were hard and nobody wants to have those moments. But I appreciate the person that it's helped me be and how that's allowed me to be able to connect with patients and connect with mentees, such as the residents in our program too. And so I think that is one example as well.
Yeah, and thank you so much for sharing that. I
Sure.
really appreciate that. And I know personally, I've also had challenges. Feeling really anxious, wondering like, do I really belong here? Like, am I really worth being part of this program or being part of this endeavor? I feel like it is a pretty common thread. Feeling imposter syndrome and feeling like, am I really worthy of being here? But being able to, as you've done it, turn it into an opportunity for growth and turn it into a way of challenging yourself, and also recognizing the great community of support that you have around you. I really applaud you for that. I think that's really amazing.
Thank
Uh,
you.
yeah. So to wrap it up, we have one final question for you. Again, we're so thankful that you've made the time to have this discussion with us. So last question is, what is one piece of advice or a few words of wisdom that you'd like to share with the current medical students and the current medical trainees, residents who are, as I would say, in the throes of their training and, facing challenging times on the daily, if not just given the context that we're living in today. What would you say to them?
Give yourself grace. Give yourself the permission to make mistakes. And kind of going back to a growth mindset too, that nobody is perfect. And we all struggle with those feelings of imposter syndrome. It really is a part of all of us, even some people that don't show it, but it's there. But giving yourself the grace that you are learning and that you're human. And those qualities, even though it may make challenges, will make you a better physician as well. It'll make you a better physician. And I think the important thing too of finding your support system, which would be other medical students and residents and your family as well. I feel very fortunate to have an amazing wife, who's a best friend too, and she's also a physician. And then the nice thing about that is, as a work peer, I've been able to share a lot of stories with her and to be able to get a lot of support. And our boys, even though they're quite young, they provide me a lot of support and fulfillment too. So I think it's important having that community to support you through the tough times and celebrate even in the good times too.
That's really great. Thank you. So again, thank you so much for your time. Thank you so much for your insights. I think this has been a really great conversation. I've loved learning more about you. And again, it's small world. As I didn't really speak much, but as you were listening, I could really relate to a lot of the points you were making. So thank you for that. So this is a great conversation. As a reminder to everyone, this event was brought to you by Ars Medica. We are a nonprofit organization dedicated to nurturing the personal and professional growth of medical students and physicians. Our online community brings together doctors, residents, and medical students to inspire and support each other in our journey towards a more meaningful practice of medicine. If you want to join our community or just learn more about us, we encourage you to visit our website, www.ars-medica.org. Again, that URL is www.ars-medica.org. And don't forget to subscribe to our YouTube channel. Thank you so much for tuning in, and until next time.